Travel bans are things that are instinctive. You would think that they would keep the virus out, but they're very, very imperfect, and they have the added unfortunate effect of penalizing, in effect, the countries that are so forward, who have made the discovery and let everybody know about them, because they have an adverse impact on those countries. Highly contagious respiratory infections are very hard to keep out of your country. It's only a matter of time before we see cases both in Canada and the United States, I'm afraid.
Okay, so what's your message then to the governments that have implemented these travel bans? And much of the public also has kind of that, I don't want to call it a knee-jerk reaction, but has that reaction that, well, that makes sense, close the borders.
Well, there are benefits, because the short-term benefits are that you can delay introduction, and by that time it's hoped that we'll learn a lot more about these variants that will help us cope. Anything that can dampen down introductions, slow the spread of this new variant around the world, is important. And so you're asking for some short-term gain, but you're going to have to pay a price for it, and most of the price will be paid by the citizens of those countries of origin.
Right. How much, too, Doctor, is this a result of first world nations, rich nations hoarding vaccines and not perhaps, looking to spread them globally, because we know this pandemic won't end until everybody is either vaccinated or immune?
A pandemic is by definition a global epidemic, and we, the countries of the world, have not yet figured out a way to make enough vaccine and get it distributed equitably in rapid fashion. So the countries of the world are still working on that. We need to keep it in mind. We in the developed world have two reasons for doing this. One is, of course, the simple humanitarian reason. We want to save as many lives as possible. But the other is those variants, they appear abroad and then can come home to our countries. So we have a self-interest in making sure that we end this pandemic around the world as quickly as possible.
Dr. Schaffer, I'm almost out of time, but how concerned are you about Omicron?
Omicron is a variant of concern. That means it's top of the mind for every public health unit in the world today.
All right, we will continue to follow the story. Really appreciate your insight and expertise. Thank you, Doctor.